Thank you, Malcolm, and everyone. Before I forget, as the day goes on, we must remember to talk in the microphones. It's a housekeeping task because this is being recorded for our global audience. So just a word of caution there. Anyway, it is my pleasure to be here. It's a very exciting day and a half. And I've had a sneak preview because we've been working months behind the scenes to getting this ready. And I really didn't realize how much time it took in planning, but it's been a wonderful opportunity. But before I get started, I want to thank the Planning Committee. So here's the Planning Committee that you can see. And if you're in here, if you can please stand and hold your applause here in a minute. But if you're on the Planning Committee, please stand so you can see they're distributed at different tables because they've worked very hard. In addition, we have consultants that we've also referred to. And last but not least, our Global Forum staff with Patricia, and Amber, Anna, and Julia. They have just been integral in getting this all together. Can we give them a hand, everybody? Been very grateful. This has been a team approach getting all this together. Anyway, on behalf of my co-chair, Christoph Pimmer, and myself, we would like to welcome about 19 health professions represented here locally and globally. Over the next day and a half, we're going to be bringing new ideas and hopefully futuristic ideas that you may never have thought about. Actually, what the title is to improve health professional education through the use of technology. As you know, we have a problem. We have a problem in preparing our health professionals for practice. Through this workshop, we hope to showcase some ideas or new opportunities for you to bridge this gap in preparing our health practitioners, new approaches in education. Through the workshop, we're going to talk about new concepts. We're going to talk about different exemplars, ideas from multiple disciplines we're taking from other disciplines and can we bring into the health professions, and also futuristic thinking. So why this topic? The question is, here we go. And before we get started, when you see all this, you have a one-pager, technology's in the middle. We're going to talk about these different concepts when I say ideas, concepts, and all that. That was just a visual the Planning Committee put together because we were very visual and concrete, so we had to see, and then we will speak about these concepts throughout the day and a half. So why this concept? So why improving health professional education and practice through technology? With the landscape currently changing in healthcare delivery, models and preparation for practitioners across the discipline, we realize there's challenges. I think everybody in the room, doesn't matter what your profession is, there are challenges in preparing our learners and maintaining the continued education and professional development. We believe through the use of technologies, we can overcome some of these challenges to improve education of our practitioners. Ultimately, that will improve the healthcare quality and patient outcomes. One challenge I bring to your attention is this academic practice divide or gap. Often, there's lots of discussions about that. How do we bridge the gap? We know our health professional students, they're in the academic setting, they're learning new skills, they're new knowledge and attitudes, and even in an interprofessional manner, but then you put them into practice, and if we're not practicing in an interprofessional manner, then there's a big gap. Are we meeting the realities in practice in our education arenas? Many times there's not. We know we are limited in academic settings many times because of the obstacles that prevent us from replicating real practice. I ask you, are there opportunities, though, in simulation or virtual environments or through the use of technology where we can teach students, most of their scope of practice in a controlled but realistic environment that we can set up? Throughout the workshop, I'm trying to change this. There will be 5 areas that we're going to be talking on, but I call these drivers to consider with the use of technology. One, let's look at the new generation of learners that comes out. Learners joining the health professionals are no longer digital immigrants, but they're digital natives. The learners understand technology far better than their faculty and the generation before them in any of that. In fact, most of these learners, don't they have 3 to 4 devices they're managing, they're handling, they're connecting with? The information's at their fingertips. They retrieve information. They're communicating through these devices, and they're exploring across the borders. They also have certain expectations coming into the learning environment. Evidence has shown that these current learners expect their faculty to incorporate the technologies needed for the profession, but also to use the technology. They are able to use certain technologies or platforms for learning, particularly in underserved areas where geographically it may be impossible or very challenging to attend classes or to have clinical experiences or to embark on a learning experience. For example, midwives in Bangladesh are learning new ways to implement mother-baby care through videos, through social media, through other technological aspects. The use of technologies for education, ongoing professional education, is needed to disseminate the information and learn the skills needed in the environment. Technological platforms to our learners are no longer a novelty, but an expectation, as demonstrated through their way of living, being, and learning. In fact, I can say for our school, students and others across the nation, if you don't have a simulation lab or space now for, I'll say, in nursing and other health professions, that's a problem. That is a recruitment tool and a retention tool that we use. But while we celebrate many of these advantages with technology, which comes, with the advances, we also have to be mindful of those risks associated with increasing reliance on these new tools and unintended consequences. And yet in this workshop, we will talk about some of those consequences and risk and implications for legal and all of that. That goes hand in hand. Another driver we all can relate to is this clinical education. As we know, clinical education has many challenges. We as educators, practitioners, and leaders, we all have to navigate this. Health professional students are assigned clinical sites to practice, typically in the conjunction with their didactic. Usually it goes hand in hand. You're taking a theory course and you have clinical in parallel. But securing appropriate clinical sites for all of our health professional students, it's a huge challenge. It's a barrier that we must navigate. According to the American Association College of Nurses, data just in the past year, noted there were 64,000 qualified undergraduate and graduate nursing students who were not admitted due to the lack of clinical sites, faculty shortage, and lack of preceptors needed for clinical education. In a recent survey of medical schools, 50% of the respondents reported concerns about the availability of residency positions for their students after graduate school, and 85% indicated concerns about finding clinical sites and qualified clinical preceptors. And this was AAMC data. And when I say clinical sites problematic, our health professions, we all compete for clinical sites. We compete for preceptors using the same many times, so that's problematic as well. So how can technology help to remedy these challenges with our admissions and acceptance of needed qualified students entering our health professions? We must also consider the legal implications of use of technology for our profession. Even when technology presents an answer to a problem, it's important to understand the implementation of these solutions. It's not as easy as one might think. We're confronted with authorization and other legal issues that must be considered. And I know we're very heavy in the online distance education learning. What's set up with us with a state authorization to getting into states to go across the state line, it's a huge challenge. In addition, I'll speak for nursing, and there's probably others, but we have another layer, and that's the State Board of Nursing. And State Board of Nursing is not standardized. It's all 50 states vary on what the Board of Nursing wants when you go in for online education. So that requires more resources, more time, effort, et cetera. The third driver to consider technology is this faculty shortage. The shortage of qualified faculty is a major challenge in preparing health providers, especially in the light of graying of our professions. Across the School of Nursing, the average age of a doctorally prepared professor is 62 years old. The average of a doctorally prepared associate professor is 58 years old, according to AACN data. In medicine, 1/3 of the physicians are over the age of 55, according to AAMC data. Without the adequate number of faculty to teach, the output of prepared health professionals will continue to not meet the demand of a growing population. However, through the use of technologies, can we support a larger group of faculty to teach health professions, open the door to use our experienced retired faculty in some aspect, and allow for content to become scalable in some manner? We need to ask ourselves, how could massive open online courses known as MOOCs help to deliver, scale up, and extend our content to health profession students? How can the use of technology platforms and methodology promote collaborations of health professions across the disciplines, across the country, across the globe? How can these collaborators partner to develop these applications? You will learn more yet this morning about, I quote, unlocking the knowledge by providing open source materials and information to our learners. It's a very non-traditional concept in higher education. Another driver, changes in healthcare. As we know, I don't have to tell you, but the healthcare environment, the tapestry, the landscape is changing. We're beginning to see a shift from the acute care to the primary care with the need of global aspects of care, a never-ending need to develop unique types. There's medical challenges that confront us. For example, the Ebola crisis. That required just-in-time learning, didn't it? Remember all of that? Our practitioners need to be prepared for the transition to practice, to deliver high-quality patient care, whether this is an acute environment, a primary care setting, such as a rural community clinic in an underserved area. But how can technology serve the need for just-in-time learning for our health profession students, interns, residents, and practicing providers? We must be nimble and ready to deploy new knowledge, practices, and new interventions when needed. In addition, to prepare our practitioners for this changing landscape, more primary care is needed. Hands down, as we move to the culture of health, more on health promotion versus disease, healthcare practitioners need to understand population health, social determinants, and have the knowledge and skills to work in the communities in these areas. How can the use of technologies help prepare our practitioners for these environments, challenges, and care for populations and communities? Last driver that we will also be talking about over a day and a half is the financial divide. As with any venture, we must consider the financial implications. Bridging the financial divide by using more cost-effective methods to disseminate education to health professionals would be another consideration for using technology in the health professions. How can you teach thousands of healthcare providers across the globe while eliminating barriers to success, reducing cost, and ensuring quality and consistency of our education? You will hear and see demonstrations today on how technologies are being used to scale up an ability to educate more people in more places. In addition, the costs are economical, sometimes free, using open source materials, and can support underserved populations, well, in any geographic area where there's an internet connection. So overall, you will hear and understand how technology is a platform or it's a tool for education in the health professions. There are certain expectations health profession students and practitioners will be confronted with during the use of technology as it becomes a major communication tool. It's also used in information-seeking platforms such as WebMD by our patients and are a way to obtain university higher education degree in health professions. I think it's in Illinois and Georgia Tech. They're putting together specialized courses in MOOCs and to get a degree. Communities are also dependent upon the use of technology, as evidenced by the impact of mobile health in Kenya using cell phones to create a community of learning among the health professionals in Africa. No longer are health professionals alone, uncertain, and feeling unsupported, thanks to the use of technology, which allows them to feel connected and empowered. Harnessing these power of technologies allow us to make an impact in communities, to create a culture of health, support and education, and to be proactive in sending healthcare messages or needed information, such as flu shots or immunizations, whatever that might be. Now I will be turning over the program to Ruth Niemeyer, who is an Associate Executive Vice President of the American Association of Colleges of Pharmacy, who will facilitate our first panel of presenters, setting the stage to discuss 3 prominent areas to kick off this workshop on the use of technology in health professions education. The 3 areas, 1 will be using social media to support digital learning, 2 we'll talk about the technology platforms, and 3, to set the stage, the current state of research on digital learning. I ask you to hold on to your seats and get ready for this journey. We're very excited. Please enjoy the workshop. We hope you enjoyed as much as we have in organizing and planning it. Thank you.